Pathology, Goa Medical College, Bambolim. He has served as ex-dean Faculty of Medicine, Goa University, and ex-dean, Goa Medical College. He has been a member of the Executive Council, Academic Council, and Court of Goa University. He is currently the president of Asian Society of Cytopathology, and he has many roles and responsibilities and representations in various local government, national, and international bodies. Sir has published over 230 publications in international and national journals. Sir has been invited as a faculty chairman and moderator for international conferences in varied countries like USA, Canada, to name a few. He has received many awards, few of which are, and he has also been appointed for formulating the guidelines for Goa for medicine and National Education Policy 2020. Sir is the chairman of International CME in Pathology, Histopathology, and Cytopathology in Goa. And it's my privilege to have you amidst us, sir. With this brief introduction, I invite Dr. R.G. Wiseman Pinto to deliver his lecture on post COVID 19 pandemic clinical scenario in Goa. Thank you.
Good morning, everybody. I have to give some instructions to the people who give the invited talks. 25 minutes will be there for the presentation. Please try to stick to the time. 25 minutes for the presentation and 5 minutes for the discussion. Only 2 questions will be allowed. Okay. I request for your cooperation so that we can maintain the time schedule.
Good morning. Thank you for the introduction. Thank you for inviting me to this national meeting. And I congratulate the Department of Zoology for hosting this event. I will be talking to you about the post-COVID-19 clinical scenario in Goa. Now, basically, my presentation is a study which is designed involving many departments. So I have as my co-authors Dr. Savio, Dr. Maria Jose, Dr. Daniel Mascarenhas from the US, Dr. Ankush Desai, who is the clinical endocrinologist, Dr. Teresa Noronha Ferreira, who is the head of the Department of Neurology, Dr. Chitra Dome, head of Department of Biochemistry, Dr. Reshma Sawant, Dr. Ramnath Neurekar, Dr. Mahadev Swami, who's a hematologist in the Manipal Hospital, and Dr. Aparna Vadkar, Pediatric Department. So, in the next few minutes, I will be talking about the COVID-19 scenario in Goa today. What is the change that this pandemic has brought about? So COVID-19 it is called because it is year 2019 where it was started and detected. It's also called SARS-CoV-2, severe acute respiratory coronavirus, and it has caused a pandemic worldwide, has affected each and everybody, most of the countries all over the world, and each right up from the poorest person to the richest person, as well as all walks of life, as well as all types of. Now, why this COVID is important? Because this COVID has caused its effects due to the disease, due to the vaccinations, due to a prolonged called long COVID syndrome, and also due to the long-term and after effects and complications of the COVID, the treatment, as well as the vaccine. Now in Goa, the pandemic was between January 2020 to January 2023. And the figures in Goa were about, we had 2,59,000 cases and deaths were 4,000. In the world, the deaths, the 670 million cases, 7 million deaths. In India, it was 44 million and deaths was about 5 lakhs. This you can compare with the last major pandemic which hit the whole world. That was the Spanish flu, 1918. At that time, 500 million cases and 50 million deaths. So from 50 million, it has now in the world, this pandemic was 7 million, because there are so many reasons. The antibiotics have developed, the treatment has developed, the knowledge is developed, prevention and vaccination. So all these have brought, still a large number of people have succumbed. Now, if you know this virus, it is just like a flu or any other coronavirus, but it is more infectious. It is more infectious and it is more lethal and fatal. Now, the natural course of the virus is it enters the person. If his immunity is good, recovers, he has to be treated symptomatically, and then, but the problem is it is highly infectious, so it spreads all over. One, so more people at one time. Two, people who are sick, who have a comorbidity or who have immunosuppression, who are having some leukemia or some cancer or diabetes or kidney disease, liver disease, they are the people, or old people, they are the people who get a severe disease and which is fatal. Otherwise, the treatment is just symptomatic. So that is the basis of this disease. So that is why it undergoes mutations and then it calms down and it drags on. Now, this study of mine is a multidisciplinary, so that is why I've got many departments, multi speciality, multi directional, and multifactorial. We have taken into account different departments. We have taken into account the patients who are coming to Goa Medical College and these other hospitals, some in US and some Manipal, Goa, Donapal. We have taken into account what were the tumor burden or the disease burden before and now after the pandemic, taking into account the age, gender, sites, organs, the severity, the some of the laboratory findings, and also the imaging, radiology, and the treatment. Now, in some cases, I'll just give an example that the things are very transient. For example, I'll just give you one example. There's a patient who has got COVID, he just recovered, and his hemoglobin comes down. He got anemia. After some time, the anemia improves. So that is one which is very transient for a short time. But one gets worried as to why there is anemia, etc., etc. Second, some effects are just temporary and some effects are permanent, because sometimes changes in the lung, there is fibrosis, and you cannot revert fibrosis. There are drugs to prevent or go further, but by and large, fibrosis is such that it can be only removed surgically, so it can cause some changes in the lung. So they become permanent and then there are progressive. So these are the figures which I told you. COVID-19 in the world, 670 million and 7 million. And as I also mentioned to you that in India it was 44 million and the deaths were around 5 lakhs. And in Goa it was 2 lakh 59,146 and the deaths were 4,000 during these years between January 2020 and January 2023. And just as a comparison, I'm repeating, the Spanish flu had 500 million cases, and the deaths were 50 million as opposed to 7 million. Now, these are the deaths which are official, documented. I'm not going into the other practical ground realities. I'm not discussing that. There may be many more deaths. And there were three waves during these 3 years. There was the first wave, which was Omicron. Second was very bad Delta, and the third wave. So, so basically, the changes are due to the infection, due to thrombosis, and due to damage to endothelium. And the changes are also due to the acute phase reactants and interleukins. Now, when the pandemic started, it was not known what exactly is how the patients are dying. Three postmortems were done in three centers. One is northern Italy, Milan. Second was Mount Sinai, US, and third was China, where they did TrueCut. So, based on these postmortems of the COVID deaths, they knew that the disease death was due to thrombosis and hemorrhage, clotting and thrombosis. Rather, so they started treating this, and that is why many patients survived. So it was proved in these three autopsies in Mount Sinai, US, China, and northern Italy. So postmortem sometimes helps you to know the pathogenous, help in the treatment. So with this, we try to study what are the changes in different organs. So the first is the heart, cardiovascular system. Now, one of the authors is Dr. Daniel Mascarenhas, Neville Mascarenhas, who is a cardiologist in the US, and also he comes to Goa. And they started getting the cases as well as our Goa Medical College during this pandemic, young people having heart attack. Now, they did angiography and the arteries were normal. So it was not, there was pain, but it was not due to the blocking of the artery. It was due to myocarditis because there's inflammation. Now, this is a viral disease, so there is inflammation of various organs. So, inflammation of the heart is called myocarditis. So, it can interfere and cause pain, etc. So, they stopped doing the angiographies in these people and treat them symptomatically. So, it was myocarditis. But some patients, because of thrombosis, developed heart attack, myocardial infarction. Many patients from our hospital also developed this MI. There was thrombosis, clots. Then, because of the heart inflammation, there may be congestive cardiac failure. Cardiac arrhythmias means the rate is abnormal. There may be fibrillation, systole, etc. Again, due to inflammation. So, these were the changes in the cardiovascular system. And these changes in the cardiovascular system, as I told you, were because of inflammation, because of thrombosis, and because of endothelial damage. Also, it is now, studies have shown that there were changes in the calcium channels. You know that calcium is required for the contraction of the heart. So there was alteration in the calcium channels, which without calcium, the heart cannot contract. So that is it. So after the CNS, we have a neurologist, Dr. Teresa. With him, with her, we studied, and we saw that there are a large number of patients who developed stroke after COVID. Stroke is a cerebrovascular accident. Uh, Artery is blocked due to the thrombus, or there were clots, or there was a GB syndrome, or there was myasthenia gravis. And some patients who were older, they used to lose their memory, they used to be disoriented. So all these are due to the CNS effect. Now, the effects are due to the thrombosis, and also due to the change in immunity. Many are autoimmune diseases. Now, old age, you get loss of memory, that's called dementia. And the severe of that is called Alzheimer's disease. And it is now shown that Alzheimer's disease is an autoimmune disease. Such cases also increased of dementia and Alzheimer's after the COVID. Then respiratory system is the most important. Besides the trachea and the lungs, there is a respiratory failure. There's difficulty in breathing, respiratory failure, and it is called as ARDS, Adult Respiratory Distress Syndrome. Patient has difficulty in breathing, you know that oxygen is required, etc. etc. And as it heals, there is fibrosis. And fibrosis causes the lungs to lose their function, partial function. So honeycomb lung, etc. So there may be also secondary infection, pneumonia, and ARDS. ARDS means adult respiratory distress syndrome. So lot of so pre-COVID, the number of cases of urticaria or allergy was 20 per week. After COVID, it become jumped to 30. So that is these are autoimmune diseases, allergic diseases, and the rise is 25%. Similarly, in the Department of Medicine, in the OPDs, more and more cases of connective tissue diseases, autoimmune diseases are coming post-COVID. Autoimmune diseases like mixed connective tissue diseases, which were not coming before the COVID. So there has been an increase. So this is because of immunological changes. Changes also gastrointestinal tract like dyspepsia, indigestion, diarrhea. Joints. Many joint diseases are autoimmune, arthritis, different types of arthritis. The cases have also increased after COVID because of the autoimmune diseases in these joints. Gynecology and obstetrics also, there's bleeding, thrombosis, changes in the eyes, dry eyes or bleeding or loss of vision. Lot of these changes have been seen. Now hematology, we have a consultant hematologist in Manipal with whom I collaborated, and he did a study of about 200 patients of after COVID and saw that there was anemia, hemoglobin was less, and 9% of these needed a blood transfusion. And two of these patients, the anemia was an autoimmune hemolytic anemia, Combs test positive. Besides anemia, the lymphocytes also are atypical. The lymphocytopenia is there. And if there's secondary infection, neutrophilia. Another very important is there was a low platelet count. And we had two patients in neurology, two young girls who after vaccine got low platelet count and thrombosis of the cerebral arteries, which were treated by her and diagnosed. The platelets done by me, so my department. So that is it. And also there was motor neuron disease, myasthenia, all autoimmune diseases. In hematology, besides this, the patients who died used to have DIC, disseminated intravascular coagulation. In endocrine, most of the endocrinologist, Dr. Desai, Ankush Desai, with whom we did, he mentioned to me that there has been no change in the endocrine, but the number of diabetes have increased, not because of the COVID, but because steroids was given as the treatment in COVID. So many patients are having diabetes now because steroids was given at that time, which should reverse. So here you will see hemoglobin A1, in the biochemistry. I took the values of these pre-COVID and the values post-COVID, 23. And The hemoglobin A1C is a marker for diabetes, long-term marker. So here also the values have increased. Liver function test also, about 47% of patients, they have a abnormal liver function test. Similarly with kidney. Now in children, we have the Department of Neuro Rehabilitation. One of my authors is Dr. Aparna, who is getting a lot of children for counseling. So what happened during the COVID? The children could not go to school 2 years. So they have a lot of, you know, mental disturbance, problems of studying, problems of the school, problems of interacting with others. So they were more glued to their TV and to their cell phones that, all these have become a now problem. So there's a lot of counseling is required, socialization, etc. in these children. These were the things which were affected. Then is the mucor. It started 2020, actually 19, but by the time Dr. Savio and Dr. Maria, my sister, and Dr. Savio, they were the pioneers in the diagnosis. They started the diagnosis in January 2020. But actually the disease came in 19, a few months before that. Now, so it went on. Then came the Delta wave. The Delta wave was very bad. So at that time, we got mucormycosis. It's a fungal disease, which is called as black fungus, layman. But it is a fungal disease, and many patients died with this. And about 50 cases, my postgraduate, I've given her a dissertation thesis, she's doing this. So during the months of April and May 2021, when there was a Delta wave, we had 59 cases of COVID which had mucormycosis, affecting the orbit, the sinuses, and many have died. And she is doing a histopathological study. Such studies also done in other parts of India. So that was the fungus. Otherwise, fungus in my histopathology we don't get too commonly. We get, but not so common. But here, 59 cases over a period of 2 months, April and May 2021. Then I've already discussed with you the three post-mortem studies done in three centers: US, North Italy, and China. In India, the post-mortems for COVID have been done in only two places during the COVID. One is BJ Medical College, Ahmedabad, where they did 31 patients. And the second one is All India Institute, AIMS, Bhopal, where they did more 50. So, and this Bhopal study, they showed that this virus and viral particles are lodged in different organs. The post-mortem study, so people who have died of COVID. Then different types of treatment were given and found, first they were chloroquine, found not effective. Then remdesivir, then ivermectin, then plasma, all has been found not effective. But it was all used and given. There's a desperate situation, oxygen and ICU care. So some of the patients because of steroids are still suffering the after effects. Then next is racial. All countries did not have the same death rate. And last year the Nobel Prize was given to Vante Pabo, who did genetic studies of races, from the animal race to man. This picture shows, I was seeing this picture, that he did the studies of these genes, and it was found that there are some races which have got a better immunity because of this genetic involvement. So that is it. Then is the so any patients who come to us today in the my practice and clinic, I have to ask, did you have COVID? How many times you had? Did you have complications? Did you take vaccine? How many doses you took? Do you have family history? So all this has to be now taken into account. Now, So with this background, everything has changed. The practice has changed, the teaching has changed, the everything has changed. But at that time there was a lot of uncertainty. But now more and more things are known. Nothing in life is to be feared. It is to be understood. Now it is the time to understand more so that we may fear less. These are the words of Madam Marie Curie, who discovered the radium. So, with this, I thank you. I'll be happy to answer any questions.
Yeah.
Yeah, please.
Actually, I gathered a lot of information about the fibrosis in the alveoli. And
Can you give a mic to him?
are you hearing me properly? Hello. 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 So there were
Fibrosis.
in the cases of fibrosis, but they were doing a lot of research at King's College London. Matthew Hind and several papers in Nature also appeared, and they carried out both in vivo and in vitro studies reversing fibrosis. It's possible.
There
See,
are drugs which are there.
retinoid. Retinoid in regeneration and medicine. I delivered a talk yesterday. So many cases were reversed from the fibrosis of the alveoli to a normal situation. These are standard publications. And in Europe and in many parts of America, this was used. So I don't know why people in India, doctors, medical schools, they didn't consult those literature to treat their patients with retinoid for the alveolar regeneration. These were the standard practices, and there are data that there were a lot of recoveries were there. And how they found it, because in vitro studies, it was found that the retinol binding proteins, which are helping not to cause the fibrosis. I also done a lot of research on fibrosis and reversal of the fibrosis. So there were so many problems while handling the cases of the post-COVID. I had no COVID symptoms, but when Covaxin vaccine was given to me, it was just close to COVID. And when I consulted the doctors, they say that we don't know how it happened. All the symptoms of the COVID were there after vaccination. So I think the problem was mishandled, mismanaged in India and in many parts of the world that caused severity in fatal cases. Thank you very much.
Yeah, that's right, what you say. First is about fibrosis. Yes. Uh, the treatment has to be started as early as possible. Otherwise, when it is very extensive, then it becomes difficult. And there are, besides your retinoid, there are many other drugs also which are being used. Now, what happened is this disease spread at an alarming speed all over. And there were other considerations which I will not talk. There are many other considerations which I'm not going to discuss that led to not the right treatment or the right research or even the vaccine was st- was being given without the proper experimental study. That was because of the fear they had to finish fast, etc., etc. But still, we have also seen, as I told you, these two young girls after vaccination developed this low platelet count and thrombosis. Young girls, 18 and 19. One had to undergo surgery. So this is one more thing. Third thing, what I want to say is that this vaccine, there were different types of the vaccines, and also there were a lot of side effects, etc., etc. And in Goa, two patients died soon after the vaccine, and my department, because I'm pathology head, uh, conducted the postmortem, etc. So all these things are there. And in Goa, in India, there were a lot of discrepancies, a lot of problem, because medicine in this case was controlled by administration, pharma, etc., which I'm not going to discuss. But I also agree that there were a lot of issues, and as you have rightly said. But at the same time, doing all over, India's things were slightly better compared to some other countries like China, because their vaccine was not, at least some who took vaccine here did not get a severe disease, did not go to the ICU. That's one. Second, we allowed the thing to spread, whereas China is zero COVID. So we have a better immunity because we were, so there were a lot of other issues and factors. But by nature's goodwill and God's grace, the pandemic has gone. And after the pandemic has gone, there were three things. There was a respiratory syncytial virus. There was also a virus of influenza, and not the COVID. So, this was, and now bird flu is also, there are a lot of things in play. And the last thing I would like to say is that we all wore masks. It's very good. It protected most of us. It protected also the children. We did not get the usual seasonal viral diseases, allergic disease. But the children, I'll tell you the other side of it, the flip side. The children were kept at home. They could not go to their school. The immunity also went down because they're not mixing. Now, when they get viral disease, many of them get fever because their immunity is down. So there's a play of plus and minus, but this is in short.
One more question, if anybody is particular.
What is the situation of those who suffer from the COVID and still survive? So COVID effect, that is negative effect on their health, is still there, or it is getting?
It is, see, Dr. Roy, it's very, it's a very complex array of situations. COVID, what is the type of patient? A young fellow, male, female, very old. Did the patient have diabetes, comorbidity? What was his immunity? What did he have a liver disease? Did he have diabetes? So all we cannot say very compartmentalized, but by and large, this has been a disease which is self-limiting. So if everything, if the lungs are okay, and studies are done in China doing CT scan at 6 months, 1 year, 2 years after getting first symptom. So it's also seen that. So that's another thing. But all those who have recovered, majority have done well, provided no immunosuppression or comorbidity. Because basically it's a viral disease. Viral disease is self-limiting, has to be treated symptomatically. It blocks the lungs. So if oxygen is given, patient comes out. So they have done. Now I'll give you an example. We had the COVID. Now I'll give you a very live example. We had during COVID, mucor was there. Mucor, I told you, April, the fungus, deadly fungus disease. And the treatment also is it's a dangerous drug, liposomal amphotericin B. Dr. Savio will, his area it is, but I'm telling. And as I was administration also, administrator, lot of doses were available. So these patients could get this, and some of these patients survived with this amphotericin, fungal. And we presented a case, Dr. Savio attended the ENT department, who recovered from COVID, who recovered from fungal. And I said he was lucky because the drugs were there. Otherwise, drugs are not there easily. This type of drug, liposomal, they have to be Since there was a pandemic, lot were big. So he was lucky he got, and he totally recovered. Now he underwent cataract operation. That is what. So to tell you that there are good stories also. But his treatment was multidisciplinary: ICU, anesthesia, ENT, endocrinology, etc., etc. So we cannot generalize.
So,
Thank you,
excuse
sir.
me, sir.
Thank you, sir.
So I have one question. So,
Yeah.
so
Yeah.
as you said that the vaccines were not really studied well or experimented. So how can the young women who are menstruating have the effects of this vaccine in the future and long term?
See, these vaccines, why they could not be studied properly is that, the time was short. Otherwise, the life of a vaccine to study is many years, years, to see the side effects, etc. Here, it rushed through. There were pharmaceutical consideration, pharma consideration, financial consideration, etc., etc. It is a well-known fact, and I can talk about it. Now, we cannot say that who will get COVID or who will not get. So a young girl who is menstruating, etc., can also get COVID, and it at that time was thought at that particular it's better to give the vaccine. But we have also seen that there were a lot of side effects. So that is the reason. Now, for example, after giving the 2 doses, I was going to the US, so I had to take vaccine. Everybody advised me not to take the third dose, including Dr. Savio. And I had gone to AIMS and PGI. So I did not take just to tell you. Now, it had to be given because, it is a emergency situation. Many things done in the emergency may not follow the whole protocol. And as I told you, this girls menstruating and low platelet count, I have seen them. And it is unfortunate, but now there should be no problem. The effect will go away. Only some people, when the immune system has been involved, they get dry eyes, they get headaches, they get long COVID symptoms. You followed, no? So that is the thing. There is no specific this, and young girls menstruation was not a contraindication. It was millions of doses were given, but those who developed complications were few, but they did develop. For them it is 100% who died and who, yeah.
Under the very complex situation what we are having in our country, it may be ethnic, it may be political, it may be regional, it may be racial, it may be so many things, variations are there. Of course, economic standards are also has to be considered. Under all these circumstances, whatever Indian doctors have done, it is a great achievement compared to any other state. If you see what has happened in great countries, inverted commas, America, people died like rats. Italy, one of the highly medically so many services are available. You are not sure whether it will come back from the market or not. But I must appreciate our doctors. They fought with the enemy, unknown enemy. They are not even knowing who months. Even to take a birth of a baby, normal maybe, it takes more than 9 months. But this vaccine has come into the market within 9 months. That time, the prime thing was saving the life. Thinking of all the after effect, what will happen to DNA, what will happen to RNA, what will happen to the evolution process, what will happen to the fitness character, that is not the thing. First, save the life. In the process, all of you are aware, more than 500 doctors have lost their life. Do you think that they were careless? Because you are fighting, when you fight with the unknown enemy, that too in a dark, you are wielding your sword, you don't know who is enemy, this kind of situation is there. So even with when the Dr. Guleria from AIMS, he had a talk in an IO. I asked him, sir, you are using mRNA vaccination, and when you touch any genetic material, what will be the impact of its impact on evolutionary process, particularly when you call a fitness characters. Somehow Dr. Guleria avoided the question because I was 101% sure that they had no time to see what will happen. First, to save the life is important. Then only you can think of what will happen next generation, 50th generation after. All these things are possible. But of course, now, after saving the life, please remember our political system. Nowhere in the world, any opposition party told that don't take vaccine. This happened in our country. Nowhere in the world, any community told don't take vaccine. If you take vaccine, that will happen, this will happen, all sorts of things. And all these circumstances, very complex situation. Please remember, India is not, I don't consider it's a country, it's a world. All type of persons are here. So under these circumstances, I agree what Professor has said regarding retinite. There are so many ways in which you can regenerate, or say you can reduce the regeneration capacity can be increased. But here, you don't have time. Time is every day was counting, and people are saying, doctor, percent. But our vaccines were much better than either Bharat Biotech vaccine or another thing. There is no problem about that. That is the thing. So here, what I want to tell you, priority is important here. Now
Yeah,
you have
Professor Pai,
Yeah.
I think it's
Well,
very nice of you.
Yeah, I will just add a few.
Complimenting the
Doctor,
talk.
yeah.
We will give a big applause to the doctors again.
Okay, give.
And
I will
Indian
just
doctors.
make
And,
3 points
thank
very
you.
fast with your kind permission. Yes, Goa Medical College, the doctors in Goa overworked. They did not take a single day off for these 3 years. My doctors, this is the first thing, for diagnosis as well as for the treatment, and under very difficult. So I appreciate your, it's absolutely correct. Number 2, vaccine. Now you say Indian, you cannot say like that. It is AstraZeneca, the research is done in Oxford. So do not say it is Indian, it is made here. It is very accurate. Okay. Number 2, Oxford, AstraZeneca, and from Pune. It was, and he had a system to make millions of doses. So that's, and it could distribute to the other part, and the one in Hyderabad. Absolutely right. And number 3, as you said, is also very right, that this was like a fire. You don't know how to put it off, etc., etc. It was just spread. Now, my paper is mostly to see today what are the effects. That is the message that I have presented in this paper, to see the effects in different organ system today, and that it will progress. I hope I have made myself very, very clear.
Thank you, Professor Pinto.
Just keep here.
Thank you, sir, for sharing your knowledge and experience, and also highlighting the current status of health status. I request Professor Sharma to please hand over a token of appreciation to Dr. Pinto.
Thank you.
Moving on to the next wake up lecture, we have Dr. Savio Rodrigues, and it's my honor to introduce this personality. This personality is an ex professor and head of microbiology, Goa Medical College. He has a professional experience which involves a series of positions from medical officer to demonstrator to professor. His teaching experience involves more than decades of undergraduate teaching and 35 years of postgraduate teaching. He has more than 55 publications, 45 of which are in national journals and 10 in international journals. He is a recipient of overseas fellowship like WHO fellowship at Thailand. His other affiliations involve he's a life member of Indian Association of Medical Microbiology, life member of Goa Medical Staff Society, member of Hospital Infection Control Committee, Goa Medical College, member of State Task Force for Vector-Borne Diseases, and many other affiliations to his credit. With this brief introduction, I invite Dr. Susie Domindos, Savio Rodrigues to deliver on zoonotic diseases, a wake-up call.
Thank you.
Put Z, put Z, it will come. Just type Z.
Which one you want? Zoo?
Put Z, no, it will come.
Zoonotic?
Yeah. This one it is.
Good morning. At the outset, I must thank the organizers for giving me the privilege to talk on this topic. I'm sure all of you know what is zoonosis. So it's not very important to go into much details, but I will highlight on certain aspects. The other issue is we got to be aware about it, because if you see, most of the infections that we get are of zoonotic origin. So we got to be aware about it. We got to see what precautions we have to take, and we have to see that animal health, environmental health, and human health are linked. So I'll be discussing on these topics. What is the extent of infection? What is zoonosis? Its classification, mode of transmission, route of entry, people for our risk, which are the animals involved, which are the etiological agents, and what are the preventive measures. So let me give you a figure that 27% of livestock in developing countries are infected, and that acts as a source of infection. It could be contaminating the environment, it could be contaminating the soil, and then it could lead to transmission of infection to men. Also, the infected animals can directly transmit infection to men. Now, India is one of the worst hit countries if you talk about zoonotic infection. And there are about 13 to 17 zoonotic infections which are very common, which we should be aware of. And global figures indicate that about 2.4 billion cases of human illness occur every year, which are of zoonotic origins, and about 2.7 millions die of infections every year. About 60% of the infections that we get are from of zoonotic origin. And if you see the exotic viruses or exotic infection, about 75% of this are coming from animals. So considering this, zoonosis is very important if we want to see that our health is in good condition. So there's a concept which is coming now, picking up momentum. And this concept is holistic viewpoint. So we have to look after the health of the environment, health of the animals, and human health. It's a triangle. You cannot just say, oh, we will look after human health only, or we will look after animals only. So unless we look after animal health, environmental health, and human health, we cannot have a uniform, healthy system. And you will find that most of this infection that we come across now, sorry, are originating in animals, and they spread in animals, and eventually the causative agent gets adapted to human beings. So these are some of the infections we have seen over the decades. Bird flu, as Dr. Wiseman called it, influenza. Yes, some books will say this was influenza virus in 1918, but many researchers believe that it was actually a bird flu. Then we have mad cow disease, which lasted for about a decade because the incubation period is very prolonged, maybe 5 years. The animal will remain healthy for about 5 years. Hantavirus in 1993, SARS, influenza, H1N1, MERS, Ebola, Zika, all coming years after year. And of course, we had a major problem in 2019. The monkeypox is there all around, and bird flu. You have seen recent reports just 25th February, Jharkhand, about 4,000 birds are killed because of bird flu. Now, what are the reasons for this outbreak? Why the outbreak spreads? Because of deforestation is a very important point, and that we have seen right from 70s. You see, the Kaisnur forest disease was restricted to Shimoga district, but as the forest was cut down, monkeys were traveling out. They were carrying the infectious agent and the ticks along with them and spreading the infection. Then there is global movement of people because of advanced facilities, people move, animal products of move. Then sometimes people don't want to disclose the animals are sick. They want to hide. They think the animal will recover. Eventually, the animal will die or animal will spread to other animals. And then sometimes there is unethical sale of laboratory animals. That happened in China. And one of the explanation for spread of COVID is because of sale of animals and experimental animals in China. And sometimes there is failure or culling of the suspected or infected animals because you think that animal will recover and you will not lose that livestock. But in doing so, you are doing the damage, you are only promoting progression of infection. And as I said, all these infections initially start as zoonotic infection and eventually they come to human beings. Now let us come to what are zoonotic infections. These are infections of vertebrate animals transmitted to men. And these are known right from ancient times. There is reverse zoonosis can also occur where human beings can transmit infection to animals. And classical example could be tuberculosis. It is also known as anthropnosis. Then there are certain conditions or infections or lesions which may get from animals which should not be considered as zoonotic diseases, like poison from glowfish. I don't know if you remember, 5 years back we have a condition in Goa Medical College where a 9-year-old boy caught a glowfish, nice looking fish, colored fish, and he ate that fish and died immediately. That was 5 years back. And then, of course, we can get poisons from reptiles and snakes and other spiders, or we can get allergy to animal skin, or we have laboratory infections, which are not to be included in zoonotic diseases. Now let's talk about the classification of zoonotic diseases. It could be orthozoonosis, where only one vertebrate host is involved. There is direct transmission like anthrax, brucellosis, and rabies. Direct transmission from that animal to man. That is orthozoonosis. Next is cyclozoonosis, where two vertebrate sources are required for completion of cycle of the infection. And there we have got the tapeworm, the beef tapeworm, the pork tapeworm, the dog tapeworm. So let's go to the other slide and see what it is. So now I'll just talk about the beef tapeworm and the pork tapeworm. The adult parasite is in the gut of the human beings, and the eggs are excreted. The eggs are taken up by the cow, and larval forms develop in the cow. And when we consume this meat, which is partially or not properly cooked, adult worm develops again. So that's the life cycle in tapeworm, beef tapeworm. In pork tapeworm, Taenia solium, the condition is very similar. The adult worm parasite is in the human gut. Eggs are excreted. They are taken by the pork. The larval forms develop in the muscles of the pig and they are ingested, and then the adult form comes. Now here, sometimes man may also swallow eggs. Then we have larval forms developing in men. And this is what happens in dog tapeworm. The dog is a definitive host, which means the adult parasite will be in the dog. Eggs are excreted in the feces of the dog. Human beings, while handling or fondling with the dog, may accidentally ingest the eggs, and the larval forms develop in the various organs, the liver, brain of the human beings. And that's the dead end. No life cycle can continue. But eggs that come out from the dog's feces can also be consumed by sheep, and the dog can get access back to the carcass of the sheep. And then the adult parasite develops from the larval forms which are in the sheep. So remember, there are two forms here, the adult forms and the larval forms. So it is cyclozoonosis. Now, metazoonosis, where two hosts are involved, one vertebrate and invertebrate host. The classical examples here will be JE virus, West Nile virus, equine encephalitis, Western equine encephalitis, Eastern equine encephalitis. And there could be also same type of transmission in parasitic diseases like leishmaniasis and schistosomiasis. So let's see the cycle of Japanese encephalitis, which is quite common, not uncommon in Goa, where the birds are the primary reservoirs, the air-breed birds, and there is a constant cycle between birds and mosquito. This is a mosquito-bird cycle, and some of the mosquitoes may bite pig, and the pig mosquito cycle or pig-bird mosquito cycle is continuously going on. And man becomes again an accidental host. When the pig population is less, or when the pig population is very close to human dwellings, or when mosquito population increases, some of the mosquitoes from this cycle come out and bite human beings. And man is the dead end. Man to man transmission does not occur in Japanese encephalitis. So this is metazoonosis. Then other terminology that can be used as amphizoonosis, where transmission can occur both ways, this way and that way. That is from man to animal and from animal back to man. Saprozoonosis, where the causative agent is coming from the animals, but it is not directly transmitted to man. It is going to the soil, and man gets infected after coming in contact with the soil. Now let us talk about some of the common infections. Zoonotic infection. We have got brucellosis. We have got cat scratch fever caused by Bartonella. We've got rabies, which is, of course, not common in Goa. In Goa, we have been having no cases of rabies since 2017, but we have got imported cases coming from the neighboring states like Maharashtra and Karnataka. But there have been no cases, good to note, and that was because of the rabies mission, which was catching the dogs. You might have seen them, either vaccinating them or sterilizing them to control the dog population. So that was a good program going on still. That is the Mission Rabies program. Then there could be other infection like ringworm infection coming from dogs and cats. And roundworm infection comes from dogs and cats. These are actually roundworms different from the roundworms we suffer, and we call it Toxocaria canis or Toxocaria catis. These are worms adapted to dogs and cats, but sometimes they can infect us and they cannot complete the life cycle in man, and sometimes they results in larva migrans, where the larval